Coming up on MedWatch today, each and every drop of medicine counts. Find out how state-of-the-art technology used at community medical centers helps make every prescription accurate and precise. And cooking up goodness one meal at a time. CY1 Dinner Club isn't about the socializing, but it's all about giving back to families with loved ones in the hospital. Plus, dream jobs can be hard to come by. Find out why some health experts say finding a job you love can really pay off. Hi there, and thanks for joining us. I'm Stephanie Bainham. A young woman just lived through what many in the medical field would call a miracle: pregnancy with pulmonary hypertension. Most women with the condition don't survive delivery, but our Julie Musgrave talked to one woman who did.
The odds would not have Jennifer Luciano here alive, holding her baby.
I was short of breath most of my pregnancy. Got really bad towards the end. The bigger I got, I think the more short of breath. So that was like my main complaint.
Jennifer was more than halfway through her pregnancy when she found out she had pulmonary hypertension.
The arteries in my lungs have been hardened and shrunk to where I don't get enough oxygen in my blood.
Not enough oxygen, which raises blood pressure in lung circulation, causing strain on the right side of the heart. The condition, when pregnant, carries a high risk of death.
You know, things start spinning and you don't really know what to think anymore.
Normally, when people do get pregnant, we would have recommended termination of pregnancy if it was early enough.
Dr. Vijay Balasubramanian is the medical director of the UCSF Fresno-affiliated pulmonary hypertension program at Community Regional, the only program of its kind in the Central Valley. He says women are most at risk for pulmonary hypertension, and the causes are broad. Anything from autoimmune disease to use of diet pills to drugs. In Jennifer's case, it was a big job to get baby here safely and to keep Jennifer alive.
Certainly a miracle, yes.
Jennifer delivered at 31 weeks via C-section. Specialists from several fields were there, about 15 doctors total in one room.
That's probably what made me feel the most safe, I guess, during the whole thing.
The entire delivery incredibly risky, but they got her here, baby Cameron, happy and healthy.
Delighted, both for the mother and for the baby. As much as we would love to have these kind of success stories on a regular basis, we strongly discourage unfortunate young women who are unfortunate enough to have this condition from pregnancy, because it may not be the same way every time.
Jennifer remains on oxygen 24/7 and will have to take medication for the rest of her life to manage her condition. But this,
it's just like any other newborn. She eats constantly.
Is a happy ending. A mom who truly beat the odds, alive and holding her baby.
The Pulmonary Hypertension Association is holding a Central California O2 Breathe Walk on Saturday, October 14th. The event kicks off at 10 a.m. at Community Regional Medical Center. Along with the walk, there's going to be a kids carnival, raffle, DJ, and so much more. All you have to do is RSVP before October 9th by calling the number on your screen. Technology continues to break barriers in the medical field, including with medications needed during a hospital stay. The pharmacy is a complicated place, managing hundreds of medications and endless doses. For example, at Clovis Community, there are an average of 3,200 items received each month, and more than 40,000 IV doses are compounded a year. We got a behind-the-scenes look with automation supervisor Philip Martinez to learn more about the technology that's making it all happen precisely and accurately. Our Julie Musgrave got a tour.
Philip, thank you so much for joining us today. It is a big job managing the pharmacy at Clovis Community, but technology is helping in a big way. What is the importance of technology here?
It really helps us manage all the things that come along with pharmacy, especially with the amount of medications we carry. We carry almost 3,000 different medications on hand, and we need to be able to resupply those things for our patients on a daily basis. So technology plays a big role in allowing us to be able to manage these without managing costs, as well as making sure that we can have the medications available for the patients that we see every day.
And I think a lot of patients will find comfort in knowing that there's a focus on correct dosage and making sure the correct medication goes there. You have 2 devices that make that happen. What are they?
We use primarily Talus for our inventory tracking purposes, and Dosage, which helps us in our IV room to make sure that we have the right medications for each patient.
How have they improved the services here?
Talus has made a big place in actually making sure that we are able to have the medications on hand. It manages all our inventory, so it allows us to actually track inventory by actual barcode on each medication as it's received. We're able to track all the pricing and information and where that drug actually gets delivered to on each area in the hospital. It really gives us a complete picture of how we're using medications and making sure that we're always in supply of those medications that are needed. And there's obvious benefits that we see from dosage in our IV room and verification of the correct medications that are going into each product that we're actually compounding on site.
So patients can kind of rest easy knowing that they are being well taken care of.
Definitely. It's really a priority for us. We really do go with the mindset that we are doing our medication stuff up there on the floor for our family members that are being served in this hospital. So we make sure that we really promote these kind of products and these workflows in order to improve the accuracy of the patient receiving the medication.
And how have you seen technology through the years make these improvements? How has it made your job easier?
It really has. It really is amazing when you look back, 10, 15 years ago when I started, when we were doing manual inventories on medications and kind of dealing with shortages and different issues and having to manage those manually, and having the ability now to be able to know what you have on hand at all times makes it a really big thing. And also with the ability to use dosage in our IV room, that really adds to the level of safety for our patients by having a pharmacist involved in each step of the compounding.
And it is special that Clovis Community has these devices here. They're not in every hospital.
That's definitely true, and we're really thankful for our donors and in our C-suite and the leadership here at the hospital. This really has promoted these kind of things for our use and really has added to the safety of our patients.
We like to hear that. Philip, thank you so much for your time. We certainly appreciate it.
Thank you.
Coming up on MedWatch today, meet a former Fresno police officer who has hung up his badge to take care of the spiritual needs of patients at Clovis Community. And teens texting for help. Hear about the trend that has one crisis group standing by on their phones to help teens in need. That's next.